if you've been thinking about getting veneers, I've made this video for you. I'm going to be covering what I think are the most important things to consider when you're deciding whether to get veneers or not. I'm going to be going through the material choices, porcelain and composite veneers, what the difference is, and the benefits and risks of each. I'm going to be discussing how long they last and what you can expect in terms of maintenance, whether you can whiten with them or not, and also non-prepped veneers or veneers where you don't do any adjusting to the teeth, who these might be suitable for. And I'm also going to touch on how many veneers you might need, and also talk about what you might need to do if a veneer breaks or comes off. So sort of maintenance and management of them in the longer term. So firstly, what are veneers? How do they differ from things like crowns? And what materials can you use? So veneers are best thought of as contact lenses on the front of your teeth, whereas crowns are more like a crash helmet that you place on the tooth or all the way around the tooth in order to protect it. So with veneers, you can control the color, the shape, and to a degree, the position of the tooth. Porcelain veneers and crowns are made in a lab most of the time, or made outside of the mouth and then bonded to the teeth, whereas composite veneers are directly built up onto the teeth. So this skips the need for a lab and also generally allows you to complete any composite veneers in one visit. Sometimes you might need a second visit to polish and shape and adjust things, but for the most part, you're going to complete it in one go. So do veneers ruin your teeth and are they reversible? As with anything, there is some nuance to this topic. It really does depend on the type of veneers that you happen to have to make. And that really depends on the position and situation of the teeth to start with. So the more that you're trying to correct, the more you're going to be relying on the veneers, and therefore the more adjusting to the teeth you're likely going to need to do. So the worse the initial situation is, and the more you're having to correct, often the thicker the veneer will have to be. And therefore, in those cases, you will need to trim some of the tooth in order to allow for a thickness of material to cover the teeth in order to correct any aesthetic issues that you might have. They are made to be as thin as possible, and often this is somewhere between 0.3 to 0.5 of a millimeter. So if they're planned well, they are relatively non-invasive, say compared to crowns. In some cases, you can make non-preparation veneers, and this is where you make veneers to bond directly onto the teeth without having to adjust to the teeth at all. This is pretty rare. There are only certain circumstances where you can do this. For example, if the teeth are shorter than they would ideally be at sort of the perfect end result, then adding to the length of the teeth using the veneer is fine. You have space for that. Similarly, if the teeth are small, if they're narrow, if there's gaps between the teeth, then you can use the veneers to close up these gaps. But if the teeth are flared, or they are already large, or they are not perfectly straight, then you do have to adjust the teeth in order to correct the aesthetics. And in most cases, that is the situation. If, for example, you straightened your teeth beforehand and you whitened your teeth beforehand, in those instances, you can generally make much thinner veneers because you're trying to correct less. But effectively, the more you're trying to correct, really the thicker the veneer needs to be, and often the more of the teeth that you'll need to adjust in order to allow for this. Porcelain veneers versus composite veneers, which one should you go for? The benefits of porcelain veneers are that they do last longer. The studies show over 90% survival rates over 10 years. Often some of them cite longer with higher survival rates, so they are pretty predictable in the longer term. They do maintain the polish and gloss that's initially there. As soon as you fit them, they're very color stable, and they will generally look the same for an extended period of time, years. So they are a good long-term solution. And as we've already touched on the downsides, that often you will have to adjust the teeth in order to make porcelain veneers that you can then bond to the teeth. The benefit of composite veneers is that you generally do not adjust the teeth at all in order to apply or add the composite veneer. It's done directly onto the teeth, done in one visit. And because obviously you're not adjusting the teeth at all, there is no risk of things like sensitivity or any nerve issues within the teeth. Often you don't, or I don't, numb patients up at all when we're doing composite bonding. It is just a bit of a long process. It takes 3, 4, 5 hours sometimes in order to complete the process, but it is completely non-invasive. The downside, however, is that the material is not as robust or as stable as porcelain. So some studies cite that they may chip every 3 to 5 years on average. Generally speaking, if things are maintained well, if people are being sort of careful and wearing night guards and things to help protect the teeth, you can significantly reduce the risk of having any problems. I've had patients who've had bonding for 10 plus years and have had no issues and are very happy with it. So in some instances, it can be a good long-term solution as well, but porcelain is more predictable in general. A common question that I get asked is, will it hurt getting veneers, porcelain veneers or composite veneers? The short answer is no. You should not be in any pain or discomfort whatsoever throughout the process. For porcelain veneers, and certainly if you're doing any adjusting to the teeth, you would be numbed before the procedure and you should feel nothing throughout. Sometimes afterwards you can get a bit of post-operative sensitivity, which can last days, or if you're unlucky, weeks. But certainly during the procedure, you should be completely comfortable. And afterwards, the risk of sensitivity is there, but it is very low and does settle down on its own with time. Another common question is, can you whiten veneers? The short answer is no. Porcelain veneers do not change color. They are very color stable. It's one of the advantages of them. Of course, this does mean that you want to make sure that you're choosing the ideal color for you, because you cannot change it afterwards. With composite veneers, there's a degree of nuance here. Because the composite that's being applied to the teeth is generally translucent, in order to give it a more natural appearance, you do then get some shine through of the teeth or the tooth structure below. And therefore, you can whiten your teeth when you have composite veneers. And certainly if they are very thin, which is generally the ideal, if they're done well, they should be quite thin. When you do whiten them, you'll have some shine through of the natural teeth. Although the material doesn't change color, you can impact the overall color of the teeth with whitening. Do veneers stain? Short answer is, with porcelain veneers, no, they do not stain. The porcelain is a very stable material and doesn't pick up any stain. The surface of the porcelain veneers are very smooth and therefore stain's not a problem. With composites, technically they can pick up stain as long as they are polished very well and you are looking after them. That is still relatively a small issue, at least in my experience. Generally, this is an issue if they haven't been polished really well, or if the surface of the composite becomes damaged for whatever reason. If there's any micro porosities that develop or any irregularities, these can pick up stain. But generally speaking, again, as long as they're polished well and looked after, you don't tend to notice much staining with composite veneers either. How many veneers do you need? This varies. It really depends on what you're trying to correct. So if you are trying to broaden someone's smile, you're trying to hide gaps between the teeth, or if the teeth are quite narrow, then you're going to want to veneer more teeth in order to solve these issues. If, however, you have a single tooth, or you're just trying to correct some of the front teeth because we're not concerned about the posterior teeth, the back teeth, then you may get away with doing fewer. It really depends on what aesthetic outcome that you want. So really just need to sit down and talk about that in detail with your dentist and decide on that together. As a general rule of thumb, it is preferable to work on the teeth symmetrically. So you want to preserve symmetry as best you can, and therefore you tend to work on either 4, 6, 8, or 10, or even 12 teeth. But you generally don't want to veneer random teeth, because you will start to notice a difference in color or surface texture compared to sort of adjacent natural teeth. So ideally, you'd want to work symmetrically would be the main thing that I would recommend doing. What if one chips or stains or falls off? So if you have a porcelain veneer that chips, breaks, or comes off, well, if it comes off and it's intact, it's a whole piece, you can generally clean it and bond it back on. You can glue it back on. If, however, the porcelain fractures, you will need a new veneer. Porcelain is chemically inert, effectively. You can't really get any strong bond when you try to repair the material, so you're better off just getting a new veneer made. With composite, it's technically easier and more predictable to repair than trying to repair porcelain. The reason for this is that you can bond new composite to existing composite. That being said, the bond strength is not as high as when it was first placed in one piece. Every time you try to add to it, the bond strength is reduced. And also, the longer that the composite's been there for, the weaker the bond strength is for any new composite that gets added to it. So generally speaking, if they've been there for a long period of time, or if you've had big fractures in the composite, you may be better off actually just getting a new composite veneer made. And how about eating and drinking? Can you eat and drink normally? Is there anything you have to be careful of? Generally speaking, function and chewing wise and diet wise, you can eat and drink whatever you want. That shouldn't be a problem. The main risk to porcelain veneers, composite veneers, or any restorative work you might end up having done, the main issue is if you grind your teeth. So most people do grind their teeth to varying degrees, especially at night. And it's the single biggest risk factor for you chipping, breaking teeth. So my advice is always wear a night guard, something to protect the restorations. But generally speaking, day to day, you should be able to eat and drink whatever you want without any problems. Another question I do get asked every now and again is whether composite veneers or porcelain veneers can affect gum health. And the answer is that they shouldn't. Providing they're done well, they should blend in to your natural tooth. There shouldn't be an overlap at the gum margin. And providing that is, they're carefully done and you don't have those type of sort of what we call overhangs, then the gum health is maintained and there's no problems, generally speaking, with the health of the teeth or the gums. For porcelain veneers, something that most dentists will try to talk about will be minimal preparation veneers. And you may have come across this if you've done any research. So with minimal prep, what that means is you are doing as little amount of adjusting to the teeth as possible to make space for the veneers to then be bonded on. And in terms of how much preparation that is, we're looking at tenths of a millimeter. So for example, minimal preparation will be somewhere between 0.2 to 0.5 of a millimeter of adjustment to the teeth. So the risks are then massively reduced when it comes to postoperative sensitivity or any nerve trouble with the teeth. When it comes to the cost of veneers, there's a few things that dictate the costs and that need to be factored in. So parts of the process which will incur costs will be planning, the material choice that you have, composite being cheaper than porcelain. There's often different types of porcelain that you can use for veneers or crowns, so that will play a role as well. Also, the lab that we may use to get the veneers made, the cost between labs can vary. The number of veneers is going to obviously have an impact, and the general complexity of the case. So depending on how difficult it might be to actually correct everything may play a role in the overall cost of treatment.